This video is a quick start guide for your 3M Attest Mini Auto Reader 490M so you can help protect your patients and your practice with fast, in-house sterilization monitoring. For more details, review the operator's manual. Place the auto reader on a firm level surface near an outlet. Plug in the unit and allow it to warm up for 30 minutes until the C1 caution code disappears. The 3M Attest Mini Auto Reader 490M is FDA cleared for use with 24-minute readout 3M Attest biological indicators for both hydrogen peroxide and steam sterilization. To ensure your steam sterilizer is working properly, test it routinely using a Biological Indicator Process Challenge device, or BIPCD. The PCD is used to simulate a challenging load item. For steam sterilizers, Amy ST79 recommends you do this testing weekly, preferably daily, and with any load that contains an implant. For large steam sterilizers, a pre-assembled BIPCD can be used. For tabletop steam sterilizers, you can make a PCD by placing a BI and a chemical indicator in the same type of package or tray being sterilized. Place your PCD in the most challenging area of your sterilizer, according to manufacturer's instructions for use, along with a full load, and run a cycle. Following completion of the cycle, remove the BIPCD and retrieve the BI. To test vaporized hydrogen peroxide sterilizers, place the BI in a peel pouch. For VH202 sterilizers, Amy ST58 recommends testing daily, preferably each cycle. Following completion of the sterilization cycle, remove your BI from the sterilizer and check the process indicator on the cap of the BI. For vaporized hydrogen peroxide sterilization, you should see a color change of the stripes from blue toward pink. For steam sterilization, look for a color change from pink to light brown or darker. These color changes confirm that the BIs have been exposed to the sterilization process. Mark the date, sterilizer number, and load number on the label on the BI. Allow steam-processed BIs to cool for at least 10 minutes prior to activation. Activate VH202 processed BIs within 1 hour of cycle completion. To activate the BI, crush it with the activator. Remove the BI from the activator and flick your wrist to ensure the purple liquid makes its way to the bottom of the vial. Confirm the liquid has covered the spore carrier. Next, place the activated BI into the auto reader. The display will show a series of dots, then incubation will start, and remaining minutes will appear under the BI. In just 24 minutes, a plus or minus sign will appear on the display when the test is complete. Never remove the BI before you see a plus or minus sign, or the results will be invalid. After a BI test is complete, record your results. You can use traditional record-keeping methods or use 3M Attest Connect. After the result has been recorded, processed BIs may be discarded according to your facility policy. For assurance that your BIs contain viable spores for each BI type used, run a non-processed or control BI every day from the same lot. A control BI is not sterilized before it is incubated in the auto reader. It is crushed and activated like the test BI. Since it is not processed, it should always have a positive result. The full incubation period is 24 minutes. At the end of the 24 minutes, you should see a plus or minus sign under the incubation well. A negative result for a processed BI indicates a successful sterilization process. A positive result for a processed BI indicates a failure in the sterilization process. If this occurs, you will hear an alarm and/or see the display flashing, depending on your setting. Acknowledge the positive result by pressing the touch button. You will need to take the sterilizer out of service, quarantine the load items, and investigate the cause of the sterilization process failure. The 3M Attest Mini Auto Reader 490M helps you protect your patients and your practice quickly and efficiently. Visit go.3m.com/490M to access the operator's manual and BI instructions for use.